So in this video we're going to talk about the lower torso surgery after significant weight loss. Now what do I mean by that? Well, what I mean is the lower part of your abdomen and your back and your flank and your buttock as well. So there's a whole range of operations that we can look at that treat those areas. Now, who am I? Well, I'm Dr. Bernard Beldholm. I'm a specialist surgeon that have dealt with this type of surgery for over 15 years now. And if you are a patient that have lost a significant amount of weight and you are worried about loose skin in your abdomen, flanks and back area, then this is the video for you. How do we lose the weight? Well, a lot of patients that come and see me, they do it through bariatric surgery, which these days are actually becoming less and less common. So all the other medication treatments and lifestyle changes and available options mean that a lot of patients are losing weight other ways as well. This video will cover a whole range of different procedures, but it will be an overview video. So we're going to overview all these so you get an idea of all the procedures available to you. I'm going to have separate videos to be more detailed on each and every one of those operations. And you'll be surprised how many different variations of these operations there are. It's really important before we start talking about the procedures is that there is a significant recovery from these ones, and I've done separate video on recovery, so you can find the details somewhere here and down in the description of this video. I've also done a video for the complications of these operations. I will mention some in this video. However, I have a separate one about the complications and an overview of what sort of complications you potentially could expect from these operations. So check that video out as well. It's up here somewhere. I think we've linked it up here, so you can press on that video, and there's a link down to the video as well down the bottom. So that covers the recovery and complications. And I do have videos on the cost of procedure as well. Now, a lot of patients obviously come and they call about the cost. What is the cost of the procedure? This is why it's so difficult to give you an exact figure when you call us, because it really depends on a whole range of things. So, BMI is one, but where is the loose skin? How long it's going to take? Are we going to add liposuction or suction-assisted lipectomy to your operation? How many days are you going to stay? Have you got private insurance? Are you covered? Is there an MBS Item number? And it's just, a lot of detail we need to know before we can give you an accurate quote for the procedure. So that's really important to keep in mind. That is why I can give you a range of costs, but really you have to come and see me to get the exact cost, and our patient coordinator will help you with that. After major weight loss, the skin does not always retract fully. That leaves a redundant skin and skin fold that can cause irritation, rashes and hygiene problems, as well as difficulty fitting into clothes and even limiting movement. A lot of my patients that have changed their lifestyle and they're very fit have issues when they're exercising, for example, and it's actually preventing them from taking that next step or getting really into it because it causes so much discomfort from having the loose skin. Now, surgery may be an option to remove the excess skin and improve the function. With the consultation process, this is really, really important. You will see me. The first consultation is usually 1 hour consultation that we go through what it is you expect. I take photos, so you will have to undress. I have a special disposable undies and disposable bra to cover your private bits, and we take photos. And then we take photos as you come for your follow-up recovery as well, follow-up after your surgery as well, and you get those photos as well. So I will send you a link to a Dropbox folder and you can get those photos. I do an examination, obviously, of the area that we are worried about. I discuss the options, and go through all your concerns and questions, complications and consent process as well through that first consultation. It can be a lot of information to take in, so a second consultation is always very, very useful. Now, I get a lot of patients that come and travel from a long way away, so usually we have one consult in person, and ideally if you are close by, then in-person consults are always much nicer than having to do Zoom or remote or telephone consults. But again, if you are from a long way away, subsequent consults can certainly be done remotely. Once you've had the first consult, I can then determine if you qualify for an MBS item number, and my patient coordinator can provide a quote. If you don't have a private insurance, then we get basically a quote from the hospital as well as the anaesthetist. But if you have private health insurance, then you may not have to worry about the hospital costs. To qualify for an MBS item number for most of these post-weight loss surgeries, you have to have stable weight for 6 months. And usually I recommend probably up to 12 months to really lock that stable weight in. You also have to have a loss of 5 BMI levels for the MBS item number, and you have to have rashes, discomfort or other medical functional issues from the loose skin. So those are the requirements of the MBS item numbers that we use. There's usually 2 or 3 different ones: Lipectomy, abdominoplasty, circumferential abdominoplasty are the MBS item numbers that we use. And you will find, if you go into the article that I've written about this, we mentioned the actual numbers there as well. These operations do get rid of the loose skin, however they do leave scars. And depending on the type of operation, it will depend on where the scar is positioned. So, abdominoplasty removes excess skin on the front of the abdomen and can repair abdominal muscle separation, also known as diastasis recti. The cut is obviously down the bottom, around the belly button, and then we pull that skin down. It's really focused on the vertical excess skin that you have after weight loss. The Fleur De Lis Abdominoplasty, from the French word Fleur De Lis, which is a water lily, the pattern that we are cutting the skin out has a cut from the top down to the bottom and then across to the side. The key thing there is that it pulls the skin in. It's probably one of the few operations that deal with the horizontal excess skin that you may have from weight loss. The circumferential lipectomy or circumferential abdominoplasty or belt lipectomy or 360-degree abdominoplasty or 360-degree lipectomy has a lot of names, is a cut all the way around your abdomen. And that treats the vertical excess skin up and down, but also the flank area. It lifts up the thigh area, and we can include liposuction on the thigh area or suction-assisted lipectomy on the thigh area to lift that up even more and make it a little bit smaller. It lifts up the bum area, so it's a gluteoplasty as well. So it's a really comprehensive operation. The only thing it does not do is the horizontal part of the loose skin. So we're pulling down, but we're not pushing in. Now, apronectomy is basically if you have hanging skin down the bottom and we're just cutting that hanging skin off. It's a fairly simple operation, can be done as a temporizing operation. I don't do it very often because it doesn't have as good of a results as the other operations. Back lipectomy or gluteoplasty is when we just cut down the back area, lift up the bum area or gluteus maximus, get rid of the loose skin in the back area. Then there's a whole range of combinations which is really, really useful, and that is we We can do a vertical excision and a circumferential together, for example. That deals with the horizontal skin and the vertical skin circumferentially. I can add an upper abdominal lipectomy with a Fleur De Lis to get rid of that excess skin that sometimes happens underneath the breast or in the upper part of the abdomen. Just an lower and upper lipectomy if that's where the skin is. So it's really about targeting the loose skin. Then we can also combine other body contouring operations. So we can combine the brachioplasty or arm lift with a Fleur De Lis, for example, or we can do breast lift, breast reductions and other things together with the other operations. The risks and recovery is really important to be aware of. All surgery carries risks. Again, we have a separate video on this, but to get an overview, it's bleeding, infections, wound healing issues, seromas, scarring, and some and blood clots and deep DVTs and pulmonary emboli, all possible. Recovery takes time, especially for the bigger operations. There's a big cut that we do in these operations, so you're going to have to expect that it's going to take a bit of time to recover from the operation. The bigger the operation, obviously the longer the recovery. For the smaller ones, we're looking at 2 to 4 weeks. For the bigger ones, you may even take 4 to 8 weeks to recover. So that's really important to make sure that you have that recovery time. Most of the time, you should be back to doing most things at 4 weeks. However, everyone is a little bit different. At 4 weeks, you're not going to be back to completely normal. You're not going to be able to run, do aerobics, push-ups or any of that stuff. You'll be doing your day-to-day stuff, driving. If you have a desk-type job, then you can go back to that. But again, if you have a little bit more physical activity, you'll have to cut back on that. I've already mentioned the cost a little bit, but there are multiple different item numbers or MBS item numbers. Now, why do I talk about MBS item numbers? The way that in Australia things work is that you have an MBS item number for your surgery, and that has specific criteria that you have to meet. If you have private health insurance, they only cover you if there is an MBS item number for that operation. So for example, let's say you have loose skin on your abdomen, but you have not lost weight, there's no muscle separation, so we can't give you the post-pregnancy item number, then that operation will be considered a cosmetic abdominoplasty. With a medical abdominoplasty, you will get you can use your health fund, but most of the health funds will put that MBS item number under weight loss surgeries, and those are usually on the gold level cover or top level cover. So most of the health funds will have those operations on the top level cover, so that's something to keep in mind. And most of these and there's usually a 12 months waiting period to access those operations. So you do have to keep that in mind if you are getting private health insurance to get your operation covered. Now, why would you get private health insurance? The key thing there is that it will cover your hospital costs, and you will get a little bit more money back for the anesthesiast. You'll still have a gap charge, but it will cover the hospital. And the useful thing there is that then you can stay in as long as you need to. If you get a wound complication, infection, a breakdown, or something that we have to take you back to theater for, we can do that without having to worry about the cost. And generally, if you have any complications from these operations, then I tend to just do it as a no gap. So there's no cost to you. You get the complication treated, and we deal with it. So that is probably one of the biggest benefits of having a private health insurance, is the hospital part of things. The other thing with the MBS versus non-MBS item numbers is that if you have an MBS item number, you don't have to pay GST on top of your cost of the operation. So with a cosmetic operation, for example, the one I was saying before about the loose skin in the abdomen, but it doesn't qualify for an MBS item number, you will have to pay 10% on top of the cost of the operation. So we quote you, and then it's 10% GST on top, unfortunately. Those are things to keep in mind. So we've gone through a lot of operations. The key thing with estimating which type of operation that you will need is what's the direction of the loose skin. So when you put a lot of weight on, you expand pretty much like a balloon. Then when you lose the weight, it comes down, and you will have loose skin in the horizontal direction and loose skin in the vertical direction, which means that these operations target the different directions of loose skin. So up and down loose skin is the abdominoplasty, circumferential, or anything that cuts down the bottom and pulls the skin down, or the upper lipectomy that pulls it up. The horizontal excess skin this way that we want to pull from the waist in, that is really the vertical incision that we have to make, and that's the Fleur De Lis Abdominoplasty. I find that is the key to getting a really good result, is to target all the different directions of loose skin that you have. Obviously you are trading the loose skin versus a cut, but I think that is a trade-off that you have to think about if it's worth or not. But if you have a significant amount of skin, for example in the horizontal direction, and we do an abdominoplasty, you're still going to have loose skin. And I think that is something that would bother a lot of my patients if they come in. So a lot of my patients will accept that additional scar to get rid of all the loose skin they have. Now, I hope you find this overview video really useful. I am creating, or have created, specific videos for each of these operations, because there's probably about a 10 or dozen different operations that we can do on the abdomen or lower torso or lower trunk that covers all the loose skin and things we can do for you. Check out the other videos, and I will see you in the next video.